Happy holidays and welcome to Dctv's special presentation in honor of Giving Tuesday. I'm Lisa D., Director of Community Engagement, Programming, and Communications here at Dctv. There are more than 12,000 nonprofit organizations in Washington, D.C., and according to the Center for Nonprofit Advancement, 8,000 of those are registered 501c3 organizations. These nonprofits have a great economic impact in the district, generating more than $40 billion in annual revenue. What's also commendable is the enormous amount of volunteer work that is performed in our communities. Our mission here at Dctv is to provide meaningful media to the residents of Washington, D.C. and the surrounding communities. We are always hard at work providing a platform for local voices to be heard and to spark meaningful dialogue to address a variety of issues affecting those residents. In 2019, Dctv launched a unique capacity building grant program for the purpose of helping nonprofit organizations increase their communications capacity and to cultivate our communities with meaningful media. We developed this grant with the guidance of nonprofit leaders who told us that getting the message out about their organization's mission is one of the biggest challenges they face, especially in this ever-evolving digital world. So today, we are here to tell their stories and to give a platform to these meaningful messages of impact. It is truly an honor for all of us here at Dctv to celebrate Giving Tuesday and to showcase the many nonprofit organizations here in Washington, D.C. and all over the DMV that are making a huge difference in the lives of others. As communities continue to face challenges and difficulties due to the COVID-19 pandemic, the services and assistance these nonprofit organizations provide to the residents are more important than ever. Giving Tuesday is celebrated each year on the first Tuesday after Thanksgiving. It was started back in 2012 and is recognized globally as a way of encouraging people to give and to help others. It is our hope that by watching this 24-hour special programming event, you'll be inspired to find out more about these organizations and the important work that they continue to do on a daily basis. Throughout this special event, you'll be introduced to various members of Dctv staff as we come together in honor of Giving Tuesday. But first, we'll hear from the CEO of the Center for Nonprofit Advancement and the Chief Service Officer and Director of the Mayor's Office on Volunteerism and Partnerships, Serve DC, with a message for our communities about nonprofits and volunteerism. Enjoy.
Nonprofits over this last year and through the pandemic have really stood in the gap. We have reached communities that government and no other support systems could get to. The communities hardest hit and the people hardest hit with challenges. So when you look at organizations that have distributed PPE, have helped to get technology to homes where young people were being challenged with virtual schooling, providing food and even shelter, those are some of the things that were so important and more important during this challenging time that nonprofit organizations were able to execute gracefully and masterfully. There is a tremendous partnership with government and nonprofits in the District of Columbia. It's Serve DC, the Mayor's Office for Volunteerism and Engagement that the center works with to really ensure that every corner of the district has support, is meeting the needs of people in communities and making sure that that drive that we talk about is actually happening.
In 2020 and 2021, our nonprofit community stepped up in epic ways, especially during the onset of the pandemic. They leaned in to ensure that there was no disruption of essential services on behalf of our residents by providing access to food delivery, housing, and health and social services. Our mayor and local government officials also look to nonprofits to be the trusted relationship and provider to their constituents for COVID-19 testing and vaccine availability. So they have really been at the backbone and the foundation of our community during this really sensitive and unprecedented time.
stay involved, stay connected. It's not enough to just sit around and watch and see what's happening. It's super important for us all to do our part and share in the work of our communities.
Hello, I'm Joel Gershon, Director of Education here at Dctv. Our next block of Dctv produced pieces are all related to the broad topic of health. On the one hand, DC has consistently ranked as one of the fittest cities in the US, but we also face certain health-related challenges here in the district. For example, it's been documented that substance abuse disorder prevalence rates in DC have been amongst the highest in the nation in recent years. So there still is a lot of work necessary to help those who need to get back on their feet. Furthermore, there are many reports showing clear disparities in the healthcare coverage that different communities are getting within the DC area. Most unfortunately, this disparity became a deadly reality when COVID set in, with some areas of the district having much higher rates of transmission than others. And while COVID has dominated the conversation about health during the past couple of years, it's not the only story out there. Up next, our Dctv production team has highlighted 6 nonprofit organizations who provide much needed health-related services in DC and beyond. These organizations are the Parkinson Foundation of the National Capital Area, Ronald McDonald House Charities of Greater Washington, Inc., Capital Clubhouse, Scad Alliance, Prevention of Blindness Society of Metropolitan Washington, and Health HIV. These organizations are doing such important work, and I'm certain that you'll agree once you learn about how they are helping DC and DC area residents stay healthy.
The so-called Clubhouse model was developed in New York City in 1948 to help people whose lives have been disrupted by mental illness. Today, 300 clubhouses around the world are building members' work skills and interpersonal relationships. Welcome to Impact Moment, brought to you by DCTV. I'm Rebecca Burnett. DC's first Capitol Clubhouse opened in fall of 2018, the only clubhouse certified by DC's Department of Behavioral Health. Today, I'm joined by Executive Director Maria Nunez. Thank you for joining me, Maria.
Thank you, Rebecca.
So can you expand a little bit more about the Clubhouse model and exactly how it works?
Sure. So the Clubhouse is based mainly on what we call a work order day. And so it mirrors regular business hours where they're from 9 to 5. And everybody comes in and is involved in the running of the Clubhouse and doing all the work of Clubhouse. So members and staff work side by side. And just to get everything accomplished during the day. And so there's 3 things that we all really need for our mental health. And one of them is to have a support network. And I think we've all learned that in the past year and a half, how important it is to have a community and to have people we know we can talk to and rely on. And the other thing is to have a sense of achievement. So we always want to feel like we're being productive, we're doing something. And then also to have a sense of independence that we can do for ourselves. And so at Clubhouse, we do all of those things. We really have that sense of community within, with all of the members working together and making friends, and just, it's we work hard during the day, but we have a really good time.
And it sounds like Capitol Clubhouse has a really great community. You guys report that your programming increases members' job tenure, their salaries, reduces incarceration rates, decreases homelessness. What is the secret behind those awesome numbers?
Well, I think really, I like to say that at the heart of Clubhouse, of every Clubhouse, really is that sense of community. And also, we know that people have goals that they want to achieve. They want to go back to work. They want to go back to school. There may be other resources in the community that they want to get. And being able to work together towards that is what really helps people. And in terms of going back to work, we have a 3-tiered employment program. So it's transitional employment, supported employment, and independent employment. And independent is if somebody says, I need your help, but I don't need you to talk to any employers for me. Just help me with my resume or help me practice some interview skills. Supported employment, we will go out with a member and talk to an employer and even provide support, after they get the job, just to check in with them, see how they're doing. But the one I think that has really the most impact is transitional employment, because we actually will go to an employer and we ask them for a position that they have available. So say it's a restaurant and they have a dishwasher position. And basically they say, okay, Clubhouse, this is your position. You will always make sure that it's filled. And so first, one of our staff will go and we train to do the job. And then once we know the job and we know the environment, we bring in a member who's really interested in working. And then it's actually the staff person that trains that member and makes sure that they're really ready to take over the job. And then the staff person pulls out, but there's still that support with both the employer and the staff member. And they only stay on the job for 6 to 9 months because it's temporary, it's transitional. But it's just for them to gain some confidence, get a good reference with an employer, and then we bring another member in so that they can take over that job. So I think that really helps with job tenure because it's just an extra bit of support.
And I think also at the same time your programming is special because they have support from the outside, but they're also being taught at the same time to learn how to support themselves and have self-confidence and feel purposeful. Tell me more about that and how it's also individualized too. Like it's a community center, but it's also about, feeling good as an individual.
So I tell people that at Clubhouse, we don't do anything clinical, like we don't do one-on-one therapy or we don't do group therapy. But the therapeutic value is in people coming in and practicing all, the skills that, they've maybe, haven't had for a while, or they just feel like they really need to improve on them. So it might be interpersonal skills. Everybody has an individual goal, and, it's a really friendly, safe environment. You don't have to worry if you mess something up. Because like we tell people, the staff, we're not very good cooks either. And we're learning along the way too. So, we're all learning something. And that's what's really great is people have those individual goals and we're like, come on in and we'll help you. We'll help you with whatever your goal is.
That's so wonderful. So if someone wants to learn more or maybe volunteer or get involved, how can they find you? What is your website?
Our website is www.capitalclubhouseinc.org. You can go on the website, learn more about us, and you'll be able to then see, that you can follow us on Instagram and Twitter and Facebook and check us out. And every Wednesday we do a wonderful Wellness Wednesday post that anybody could really benefit from. So do check us out.
And thank you to our viewers at home for tuning into this episode of Impact Moment. It's part of Dctv's nonprofit capacity building grants program, bringing meaningful media to the DMV's nonprofits that are making a difference. Find out more at dctv.org/grants and stay up to date with our latest productions on our live stream at dctv.org/live.
We need to do something for elders, LGBTQ elders in particular. We're creating environments that are welcoming, that assist older people in their golden years.
Housing is a real challenge because affordable housing continues to become more difficult to identify.
You want to be able to have access to really good health care.
Being comfortable. That means the space I'm in, I'm comfortable, all my needs are being met.
Sometimes this world can be cruel, and when I feel that I can go to my brother or my sister and it can comfort me, and it makes me feel like I can take on anything.
there are some of us that are forced to go back into the closet because of discrimination. So we need to address that. And how do we do that? We build houses like Mary's house that are LGBTQ affirming.
As human beings, we need family, community, and Mary's house will allow that to happen.
When people think about healthy babies, I want them to remember this quote from Abraham Lincoln, that we rise by lifting others.
Every dollar goes to those young girls. If they don't have socks, if we find the money, they're getting socks. And if any extra dollar can go to their education, that's where it's gonna go.
The most important thing is that it only takes one person to walk in through that door and to help make a change and to change that mom's life and that child's life.
The impact and the time that they spend here makes a dramatic difference.
Scad stands for spontaneous coronary artery dissection, and it's literally a tear in the artery. And because there's a tear, it allows blood to go in the wrong part of the artery and create a blockage. And that's why it's so important to know about. It's not plaque. And I've had doctors say that. They're like, oh, you really had a plaque rupture. There's always the naysayers that, this is just cholesterol, plaque, it's, the implication is that, oh yeah, you're selling this as something that's spontaneous and not novel, but it is. It's something that we really do have to focus on and research and get to the bottom of.
Heart disease continues to be the leading cause of death in women, and while spontaneous coronary artery dissection, or Scad, is less common than heart attacks caused by plaques, research suggests that it may be the most common cause of heart attacks in younger women and in women during pregnancy. Despite this knowledge, women are vastly underrepresented in medical research, particularly women of racial and ethnic minority groups. That is why organizations such as the Scad Alliance are pivotal to furthering women's heart health research.
Scad is an uncommon disorder. It really affects about 1% to 2% of patients who present with heart attacks. But if you were to look at the subset of women who present with heart attack who are under the age of 50, about a third of those cases will be from spontaneous coronary artery dissection.
When I had my Scad, I was told that I was a one-off, that I would never meet another person that had this, and that I shouldn't worry about it because it was so rare. And I just didn't believe that. That just seemed improbable to me because it was something within my makeup, in my body, that had happened. So that's what kind of drove me to pursue research, because I felt like there had to be other people out there. With the blessing of the internet, I was able to find those people and launch the research. And here we are, about 18 years later after my heart attack, and I know many, many women across the world who've had Scad, and some men. So we know that this is a cause of heart attack, predominantly in women, we think. And it's the leading cause of heart attack in pregnant women, and it's possibly up to 40% of women under the age of 50. So that's a lot of women's heart attacks that can be hopefully prevented through awareness and education of the medical community. Scad isn't as rare as people thought, and maybe that's because it was happening mostly to women. Medical research historically has only included men and then applied the findings to women, so who knows? But the fact is, Scad survivors want answers and want to stop Scad.
According to the CDC, about 3 million Americans have glaucoma, which is the second leading cause of blindness worldwide. The CDC also estimates 50% of people with glaucoma don't know that they have it. Welcome to Impact Moment, brought to you by Dctv. I'm Rebecca Burnett, and today I'm joined by Dr. Leslie Jones of the Prevention of Blindness Society of Metropolitan Washington to explain how the organization is improving adults' quality of life. Welcome.
Thank you, Rebecca. Thanks for having me.
Now, Dr. Jones, you're the Associate Professor and Chair of the Howard University Department of Ophthalmology. Can you kind of explain to our viewers how you and the society kind of work in tandem and what your role is?
Well, I'm proud to be a board member of Prevention of Blindness, Washington Metropolitan, DC. And essentially, I have been working in the community for over 20 years, fighting in particular glaucoma blindness. I'm a glaucoma specialist as well as chair of ophthalmology at Howard University. And so we have a shared mission to increase awareness of glaucoma in our community. Glaucoma is a host of different types of disorders that end in damage to the optic nerve. The optic nerve is in the back of the eye, and it's seen by the eye doctor once you have dilation of your pupils. In our exam, we can take a look and see if there's damage to the nerve. Unfortunately, the conditions that cause glaucoma, many people are unaware, do not have symptoms as the damage is occurring. And once they become aware, it's often very late in the disease stage. Early on, a patient really is asymptomatic. And that's why once a person knows they have vision loss, it's due to glaucoma, it's often very late in the disease. So individuals definitely need to be checked once they're age 40 or older if they're of African descent, and in other races, age 60 or older, to make sure your doctor can make you aware if you have the disease or if you're at risk for the disease.
And I know that the Prevention of Blindness Society of Metropolitan Washington is working on a new glaucoma program to eliminate barriers to treatment. Can you kind of preview what that might look like, but also what are kind of the best ways to remove those barriers to make sure that people have the resources that they need?
Well, this program is entitled See for Yourself, and it's really making individuals aware of when they need to have examinations, about the prevalence of glaucoma in their community. In Washington, D.C., that's around 3.1% of residents, or 10,000 or more individuals have glaucoma, and that's much higher than the prevalence of the disease in the U.S. overall, which is around 1.9%. So it's to make people aware that this is a problem. It's a public health problem, that it's very prevalent in the community, and that you need to have your eyes evaluated because you may not have symptoms early on in the disease.
So besides this new program that you're rolling out, what have you been doing in the years since your founding to sort of combat glaucoma and spread the word about the disease?
So for many years, Prevention of Blindness has been engaged, and for the past 20 years, I have been engaged in screening programs throughout the city. Screening and early detection is key, but once you are detected as someone at risk, it's very important that you have follow-up care and a full eye exam. And as I may have mentioned before, that you have dilation and evaluation of your optic nerve by an ophthalmologist. In addition, POB has many education and awareness activities. Health literacy is key, making sure that individuals know that they need to have an eye exam at least every 2 years. And if risk factors are identified, their providers can let them know if they need to be evaluated more frequently. But POB gets the word out about awareness and making sure that people avail themselves of the resources that are available.
Well, it's wonderful work that you all are doing. Where should people go if they want to learn more information?
Well, in particular about glaucoma, you can learn more about the See for Yourself program at glaucomadc.org. And you can go to the Prevention of Blindness Society Metropolitan Washington's website to learn more about our organization and to learn more about how you can use the resources that we can make available to ensure you have good vision and can function well in your environment.
Well, thank you so much for taking the time today. I really appreciate it.
You're so welcome. Thank you for having me.
And thank you to our viewers at home for tuning in to this episode of Impact Moment. It's part of DCTV's nonprofit capacity building grants program, bringing meaningful media to the DMV's nonprofits that are making a difference. Find out more at dctv.org/grants and stay up to date with our latest productions on our live stream at dctv.org/live.
Everyone Home DC works to end homelessness in the district. We provide holistic support to both individuals and families at risk of or experiencing homelessness. Our street outreach program is designed to meet people where they are and address their immediate needs, including just basic survival issues, especially in the extreme heat and cold weather. But our real goal is to get every single one of our clients in our street outreach program into permanent housing. Unfortunately, there's currently only about one housing solution for every 10 people who need a place to live. And so that means that we have to help them to stay connected to the community and to services and to stay as healthy and have the best life that they can until we can get them housed. We also, of course, have volunteer opportunities at Everyone Home DC for people who would like to get involved with us. Go to our website, everyonehomedc.org, and find out more about how you can help.
Capitol Clubhouse is a community of adults with serious mental illness who come together as part of a work order day. Everybody comes in, they choose what duties they want to work on. The idea is that by participating in all of those things, people are also preparing to get back to work or to get back to school. So often with mental illness, people might isolate, they'll be away from people. And so getting back into community is really important, and being comfortable.
I was bored and depressed. My case manager came to me one day and told us that there was a new clubhouse. We came the next day and we started. Capitol Clubhouse is a beautiful environment for people who have had various ups and downs in their lives. We have a chance to just come together, know that we all have some kind of something that goes bump in the night, something that gets in our way of what we want to do. Yet, nobody cares about that.
When you hear about mental illness, you usually hear about it in the news in a really negative light. You know, and I think a lot of people, that's all they know about mental illness. They hear it and they immediately think something dangerous and violent. Our members certainly do experience that in the community, and that's one of the wonderful things about Clubhouse, because when they're here, they tell us how wonderful it is for them to really feel accepted, you know, and understood. And if they're not having a good day, or if something is going on, we're understanding about that. We help our members to prepare their resume, to prepare for interviews, to make sure that they have the clothing that they need for a job or an interview. And so we'll help with all those readiness skills.
What I like the most about Clubhouse is that it's a school without walls. We get to work together with staff We're on a first name basis with everybody. They want our input on everything that we do.
At Clubhouse, we say you're wanted, needed, and expected. And that's something that when our members get up in the morning, they know, oh, they're really expecting me at Clubhouse because I'm going to do this when I get there.
According to the DC Health Department, over 12,000 residents in the District of Columbia are living with HIV, or the human immunodeficiency virus, which attacks the body's immune system. The national nonprofit Health HIV advances effective prevention, care, support, and health equity for people living with or at risk of HIV, AIDS, and hepatitis C. Welcome to Impact Moment, brought to you by Dctv. I'm Rebecca Burnett, and here to break down Health HIV's mission is the organization's Director of Communications and Content Strategy, Matthew Pryor. Welcome to the program.
Thank you for having me, Rebecca.
Before the COVID-19 pandemic began, of course, you guys were created before then. You've adjusted your strategies to address what you guys call the Syndemic that's affecting underserved populations now that they're dealing with both HIV and COVID-19. What is a Syndemic, and how have you kind of had to adjust your strategies to help people?
Sure. So a syndemic is a co-occurring epidemic. So we see syndemics of HIV, STIs, hepatitis C, the opioid epidemic. And we've made it a real point to try to focus on the syndemic approach, meaning that we recognize that there are forces that underlie and drive all of these epidemics. And that's, socio-demographic information, like how much you make, what color your skin is, where you live, what kind of access you have to healthcare, all of these things that drive all of these epidemics and that are shared by all of these epidemics.
And how are underserved populations disproportionately affected by HIV?
Sure. So underserved populations kind of bear the brunt of these epidemics, especially the HIV epidemic. Research and data continues to show that those people who are poor, or those people who are of a racial or ethnic minority community are at a much higher risk of acquiring HIV, and that also at a much higher risk of having really negative side effects and health outcomes from having an HIV diagnosis. So, it really boils down to the systems that are in place for access to healthcare for these people, whether that's access to insurance so they can see a doctor, or it's access to high quality healthcare, or racism that's kind of built into these systems that were built like a long time ago and that are not really built for especially communities of color.
And I would imagine that your annual conference, Synchronicity, kind of brings this to attention. You have a long list of things that you cover. HIV, hepatitis C, sexually transmitted infections, LGBTQ plus health, health equity. That's a lot of different topics. What is the goal of your conference?
Sure. The goal is pretty simple. It's a recognition that there are forces that drive all of these epidemics, and that if we were to, we can't end one epidemic on the back of another epidemic, meaning if we have any hope of ending the HIV epidemic, which has been identified as a goal of both the previous presidential administration and this current presidential administration, then we also have to address the syndemics of STIs, hepatitis, opioid epidemic, and we really need to be promoting LGBTQ health and health for racial and ethnic minority populations.
So if anyone wants to learn about your next conference or just check in on what you're up to these days, what's your website and what's your social media?
Our organization's website is healthhiv.org, and the same thing for social media. So please check us out.
All right. Well, thank you so much for joining me today. I appreciate it.
Sure. Thanks for having me. I really appreciate your interest in this.
And thank you to our viewers at home for tuning in to this episode of Impact Moment. It's part of DCTV's nonprofit capacity building grants program, bringing meaningful media to the DMV's nonprofits that are making a difference. Find out more at dctv.org/grants and stay up to date with our latest productions on our live stream at dctv.org/live.
In-Series uses music and theater to connect in tangible and dynamic ways with DC residents and particularly its underserved communities. Each season we produce 6 main stage productions throughout Washington, D.C. As an itinerant company, we tailor each production to the neighborhood we seek to serve, folding in an expanding range of aesthetic and cultural traditions. We imagine a thriving global community in which opera and song is fully integrated and is an essential part of the collective conversation. In picturing the journey to this end, In-Series is a change maker, a force that radically transforms perceptions of who, what, where, and why of opera. Who gets to make opera and for whom is it made? What is defined as an operatic experience? Where do operas take place? And why we make opera that matters. We are committed to excellence, creativity, and accessibility to our shared, multifaceted musical heritage. To discover more, visit inseries.org.
Well, our nonprofit, the Emory Beacon of Light, has provided a number of services, and we have the Beacon Clean Team, which we were able to get a grant from the city to hire persons who are looking for jobs. We provide an immigration clinic, where we've had a clinic here once a month for people who need help with gaining immigrant status. We have a very popular food pantry that's pretty full on Tuesdays, and the need is tremendous, and we've been running out of food almost every week. We have the Beacon Brightwood Business Alliance, which has provided support for the small businesses up and down Georgia Avenue, and other programs. Our whole goal has been to help this community be whole and to help this community be self-sufficient. Brightwood is a tremendous place, and we're just happy to be a part of the fabric of this neighborhood.
PFNCA is holding its annual Walk Off Parkinson's Awareness Program. We have hundreds of people here who have Parkinson's or have loved ones that have Parkinson's, and they're coming to learn more about the disease and to support each other.
Parkinson's disease is a neurodegenerative disease. Usually starts average age around 60, sometimes younger, and it's a degeneration of a really small part of the area of the brain that causes most of the symptoms.
It's a chronic disease. In many ways, we have lots of different ways that we can treat the different symptoms. So if you get that diagnosis, you shouldn't be discouraged, because there's so much that we can do to help you to live a life that's, full and that maintains the quality that a person would want.
It's important to get diagnosed early because there are things that you can do as a patient to help your disease, and it's important to start early.
9, one more, 10. How did that feel to do?
Some of the most important things to do include regular aerobic exercise.
We're gonna put these to the side for a minute. We might come back to them. Every day you live with Parkinson's. Every day you either get weaker or you get stronger. So we do yoga stretches, we do regular stretches, but what I really love is the neuroscience part, where we do the fingers, because there's so many regions in your brain that are affected by fingers. The more you do it, the better it is. Bring it down to your knee, touch index, middle, ring. My father had Parkinson's a long time ago when people didn't talk about it and there weren't classes like this. It was like people were embarrassed to have Parkinson's. Index, middle ring. It's not like that now because places like PFNCA, other places around the country, we embrace this.
There's an important thing of acceptance of the disease. And once you can accept that you have this disease, you'll realize that you can live with this and you can have a good life.
This is Impact Moment right here on Dctv. I'm Alvin Jones, and it is my pleasure to share with you today the CEO of Ronald McDonald House in the Washington, D.C. area, Karen Torres. Karen, welcome.
Hi, thank you. Thanks for having me.
Well, you know, Ronald McDonald's, I mean, any kid growing up, that's the place to go, that's the place to be. And the fact that you guys created the Ronald McDonald House so that parents would have a place so that they could be close to their children. Let's talk about that whole concept.
Sure. Well, our mission for 40 years, this is our 40th anniversary, has been to try to remove the barriers to quality health care for all children. That's our dream, that one day all children anywhere will have the same access to the very best health care possible. And our Ronald McDonald houses help remove those barriers. They allow parents a free place to stay, to have their meals, transportation to and from the hospitals where their children are hospitalized for very serious injuries or illnesses. And we also provide the social support services. Studies have proven that children heal better when they have their support with them, and families do better with their children in the complicated protocols when they do feel supported and rested.
You know, I've been working with childhood cancer organizations, and I know how important it is. And what people don't realize is, in the process of going to visit your child, going to doing all these things, you still have to eat, you still have to take care of these other things. And,
right.
and places like Ronald McDonald House provide a place at the end of the day after being in the intensive care unit for like 16 hours with your kid. You're tired, you want to go home, you want to rest. And that's what the Ronald McDonald House, to me, does for those families.
Absolutely, and there are usually other siblings involved, and the stress of parents having to worry about who takes care of those children. We encourage siblings to stay, other family members, again, for that support system. And we enable them to worry about their child and not those details about, I have to do the laundry, I have to worry about what to feed them in a healthy meal. So that is our mission, that if we can relieve any of those burdens, we feel like we've done the best for that family we can do.
Yeah, I mean, if you think about it, being a parent, that's the toughest job you're ever going to have. And if you got more than one child, oh my goodness, you got to manage that. And then if one of them is sick, then you've got the concern of them being sick. And now the rest of this still has to go on while you're managing, you know, in your heart, the health of your child and wishing them to get better, but all these other things are still going on.
That's true. And I think, say, the most well-known of all of our programs are the Ronald McDonald Houses, but we also help address keeping children healthy. We have 2 Ronald McDonald Care Mobiles that are 40-foot-long pediatricians' offices, and we bring free health care to our most vulnerable children in DC wards 5 through 8 by bringing the health care to where they live and where they go to school to remove that barrier.
Wow, in fact, you see Ronald McDonald on the outside,
Sure.
that kids would want to come in. Now, I understand you guys are expanding, and tell us about that.
Well, the good news, bad news. The good news is that with treatments, that more and more children are able to be helped. However, with the limited number of rules, we've been having to turn away more than 200 families. So we decided that to do that, we really needed to expand and renovate both of our Ronald McDonald houses. So, you know, why not do them both at the same time? We're doing the Washington, D.C. house now, and then as soon as that reopens, we'll close and do the Northern Virginia house, and we'll expand up to 56 bedrooms to help even that many more families and children.
You guys have had a lot of successes. What are some of the challenges for you?
Well, of course, the challenges, and particularly in today's world, in this COVID pandemic, is that we had to rethink how we could offer services. Of course, the houses still have families, but under much more stringent infectious disease control and distancing, and we have the same challenges as how do you maintain those safe distances while keeping them fed and extra cleaning. We also were not able, for the safety of the families, again, our most vulnerable in downtown DC areas, and the healthcare providers, to repurpose the care mobiles. So rather than bringing the children on those units, we've moved to telemedicine, and this is with Georgetown MedStar University Hospital pediatric team. They're fantastic pediatricians and healthcare workers. We quickly, though, realized that these same families were the most vulnerable during this COVID pandemic, that they couldn't go out to get food. There is food scarcity. So we repurposed those units and have been delivering food and medical supplies, and they're not just medicine, but diapers, much needed to these same families, while continuing to treat them as best they could.
You know what? I like the fact that the Ronald McDonald House has been able to adjust to the situation and respond to what's going on and still provide services. If someone wanted to know more about the Ronald McDonald House, how would they find out?
Well, of course, you always go to our website, which is rmhcdc.org, and there's a list of ways to help with our various programs.
Well,
and
great.
we still need that help. We're still operating despite the restrictions.
All right, so they still need your help. They're still doing great things, and we want you to get involved with the Ronald McDonald House. I'd like to thank Karen Torres, Ronald McDonald House for the Washington, D.C. area. For Impact Moment, I'm Alvin Jones, right here on Dctv.
We are glad that you are here with us on this special day of programming as we pay tribute to the incredible and critical work that nonprofit organizations are doing to make an impact in our community each and every day. I'm Julia Reardon, Grants Manager and Producer here at Dctv. One of the many reasons that we are here today is to highlight the hard work of our nonprofit grantees serving Washington, D.C. and the greater DMV area. Through our grant program, we engage storytelling, nonprofit expertise, and showcase the impactful work that our awarded grantees are doing in the district and beyond. The vision for the Dctv Nonprofit Capacity Building Grant Program really started many years ago. We have always known how critical the nonprofit sector is in DC, the mecca for nonprofits. So many people are served by nonprofits in so many ways, so we started working with nonprofits to help create and distribute meaningful media that is impactful. The Dctv Nonprofit Capacity Building Grant Program was established in 2019 to help nonprofit organizations build their media capacity and to provide video benefits directly to the hands of nonprofits by having them appear in our Dctv produced original programs. We wanted to share expertise from nonprofit leaders in a different way for our communities. This year, we have had 2 grant cycles join us. These are the recipients of the 3rd and 4th cohort of grantees. As we press through these unprecedented times, while we continue to see the effects of the COVID-19 pandemic, we are now more than ever invigorated with our purpose to enhance nonprofit media capacity in these times where video and visual storytelling is needed more than ever. Congratulations to our grantees. We invite all nonprofit organizations who serve Washington, D.C. and the greater DMV area to apply for the Nonprofit Capacity Building Grant. We award grants twice a year, in January and in July. So if your organization is interested in applying for this unique grant opportunity, please visit us online at www.dctv.org/grants to find out more about the program and how to apply. Let us help your organization tell quality stories about the important work that you do to make a positive impact in our community.